Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's COVID-19 pandemic update with data accurate through October 7th, 2021. This week, I'm going to ask a basic question, which is what are the three most important facts that I need to understand about the pandemic today? And I'm going to say there's three of them. One, the rate of growth is slowing, but it is still high. Two, we continue to see peaks and valleys both in time and place, and I'll explain why that's important. And lastly, the vaccine is by far the best tool we have to protect ourselves. In terms of the rate of growth is slowing but still high. Globally, we're approaching 5 million deaths. But what we've seen in the last 2 months is a slowing in the number of daily deaths, and that's very good to see. So it is slowing worldwide, but there were still 51,000 deaths last week. And if you look at where we were historically, we're still about where we were in the first peak that caused so much concern and more daily deaths than we saw for almost all of last summer. So while it is slowing down, it is still significantly high. And the same in the United States. We're seeing a continuing down now the last couple of weeks of the number of daily deaths, but there have been over 700,000 deaths in our country, 13,000 deaths last week, almost 2,000 deaths a day. And you can see that the rate, while it's coming down, is still higher than it was for most of the summer, both last year and this year. And then in terms of Tennessee, again, we are seeing this coming down again. But again, 15,000 total deaths, almost 300 deaths last week. And you can see that it's higher than it has been at any time except during the winter peak. And then in terms of ballot health hospitalizations down to 293, it's good to see it below 300 again. But again, this is still very, very high. And except for about 6 weeks in the winter, this is the highest rate that we've seen. So while the growth rate of the pandemic is slowing down nationally, globally, nationally, and in Tennessee and in our region, it is still very high. And this is particularly worrisome because we continue to see peaks and valleys in both time and place. Now, time is pretty obvious, right? I've already pointed out that there have been sort of 4 distinct waves globally, 3 distinct waves in the United States, and 2 distinct waves in Tennessee. And there's no reason to believe that unless we do something about this pandemic, we're not going to continue to see these waves. They might be larger, they might be smaller, but the fact that there are these waves suggests that we're not out of the woods yet. It's also important to remember that these waves are occurring not just in time, but in place. So you can see back in the very beginning, this light green color was Europe. Most of the deaths were occurring there, and most of the cases were. This is mislabeled. It says cases, it should be deaths. Then over the first summer, it was mostly in the Americas. Then during that winter spike, it was sort of a combined of Europe and Americas. Then the second peak globally was largely driven by Asia. And then you can sort of see some level of equality. So it's important to understand that even if the pandemic is slowing down in one place, it may be picking up somewhere else, or it may come back in the future. And then finally, the vaccine is by far the best tool we have to protect ourselves. And let's just use our local data one more time. If you look at everyone in Southwest Virginia, Northeast Tennessee, our vaccination rate is about 47%. If the vaccine wasn't effective, we'd expect about that many people hospitalized, that many in the intensive care unit, and that many on ventilators. But in fact, the percent of hospitalizations is much lower. The risk of being hospitalized has been reduced by over 80%. The risk of being in the intensive care unit has been reduced by 92%, and the risk of being on a ventilator has been reduced by 96%. These are huge numbers, and anyone looking at that would realize that the best thing we can do to protect ourselves, to prevent future peaks, and to bring the pandemic even slower is to get folks vaccinated. So the most important things to understand is, yes, the growth rate is slowing around the world, in our country, in our state, in our region, but it is still very high, and thousands of people are dying. We continue to see peaks and valleys, which suggests that even if the rate is slowing, it's probably going to pick back up again in the near future, and vaccines are by far the best tool we have to protect ourselves. And it's really pointless arguing that point. The data are overwhelming on that issue. A great deal more information about COVID-19 on the College of Public Health website. If you're sharing these videos with anyone, please do. And if you'd like to add them to our website, please let Jan Stork know at this email address. Thanks as always to Dara Young for editing, producing, and posting these videos. And please send me your questions. I'd be happy to try to address them either offline or in next week's video. Until next week, please be well, be healthy. Talk to you soon. Bye-bye.